This is Poslink Listen, Living Positive Victoria's podcast by and about people living with HIV. For more information about the programs and services that LPV offers, please visit our website at livingpositivevictoria.org.au. You can also follow us on Facebook, Instagram, YouTube, LinkedIn, and Twitter X.
Hello, my name is Bo Newham from Living Positive Victoria, and welcome back to Viral Stories, the podcast for our HIV Positive Storytelling Night. This episode was recorded on the unceded lands of the Kulin Nation. Viral Stories is Australia's first ever storytelling night centering people with HIV. Join us for these incredible stories of activism, motherhood, migration, sex, love, and perseverance. Today's story is from David Menadue. For many within the HIV positive community, David needs no introduction. A long-term survivor of HIV who was diagnosed in November 1984. And since the late 80s, he has been involved in HIV advocacy work with Living Positive Victoria, Fawn Harbour Health, AFAO, and NAPWA. In 1995, he was awarded the Order of Australia for his services for people with HIV/AIDS. Enjoy his story.
I fear mine's going to be a bit serious after. Don't know whether I can crack too many jokes, but thank you. I have concentrated on the early part of my life being positive, and my partner Joko, who you just saw then, told me it's a bit sad. So I'm sorry if it's a bit sad, because it was. I was diagnosed with HIV in November 1984 in the very basic settings of the Communicable Diseases Centre, then in Little Lonsdale Street in Melbourne. A labyrinth of small cluttered rooms in a less desirable part of the city, the clinic fitted my mood a little. This was where you went to be diagnosed with the latest sexually transmitted disease, got your treatments and scuppered off, leaving that little secret behind you. I was not quite sure how to respond to this diagnosis, though. So little was known about the virus at this time, even definitely how it was passed on between people, that I didn't know whether to be alarmed or just accept it as maybe another STI I developed a resistance to in my body, which might not do me much harm in the long term. And my doctor, David Bradford, who has become one of the most informed HIV and STI doctors in the country, wasn't quite sure either. While he, along with the gay leaders of the time, had been watching developments in the US in particular, where deaths mainly in gay men had been climbing into the thousands since the early 80s, David could not say if my diagnosis was likely to lead to AIDS or an early death. You will most likely only have a 1 in 10 chance of developing an AIDS illness, he said, stating the view of medical experts at the time that many of us would have immune systems that could keep the HIV virus in check. Of course, we now know that HIV was a much more damaging and indeed lethal virus than any of the STIs that the modern gay man had to live with in those times. You could take a course of antibiotics for common STIs and be good as new in a few days. The revelation of this difference, though, only started to become clear to doctors and to the broader community as the 80s unfolded in Australia. In my home state of Victoria, we only had a small number of reported diagnoses and a few deaths until the mid-80s. The Victorian AIDS Council had been set up in 1983 and were preparing care teams to deal with the expected wave of AIDS diagnosis, but they had very little to do until the latter part of the decade. I had been to the two meetings which began, our AIDS response, the public meeting at the dental hospital in July and the subsequent meeting at the Laird Hotel in Collingwood, which decided to set up the AIDS Council. I didn't put up my hand to sit on the first committee, even though I knew many of the members from my early gay activist days. I'm not sure why I was reluctant to enter the fray, partly because of work pressures at the time, but maybe partly because I had a suspicion I might have the virus on board already. I had these swollen lymph glands under my arms and my groin, which came up after a fairly wild 1982 Mardi Gras celebration. Well, we've all had them. So, connect the dots. But a GP at the time wrongly thought it was probably a transitory infection, so I didn't worry particularly. Even so, I wondered if it might be best to sit tight before throwing myself into the new movement, which might prove taxing on me physically and I guess mentally. Looking back on that time, I see it as probably a wise move not to immerse myself in the often tricky politics of the AIDS sector, as I tried to work out how to live as comfortably as possible with the virus. My time would come as the need for people living with the virus to have a say in the way things were being managed became clear in the late 80s. In the meantime, I felt a rising level of agitation as news started to emerge from overseas that people with HIV were very likely to develop AIDS-defining illnesses, almost a suggestion that all of us would. And over time, as the virus was constantly working itself to damage the markers of your immune system, the T cells, there were no effective treatments to stop it. And who could you tell about your diagnosis? There was so little understanding in the community, you wondered if nearly everyone might reject you if you blurted out the news of your diagnosis. So you were living with this huge secret. I sought out the services of a counsellor at Fairfield Hospital, the main treatment hospital for infectious diseases in the state at the time, and found a receptive, non-judgmental ear in the counsellor who helped me to focus on my well-being. It was perhaps not surprising that the focus of the AIDS Council staff was then on developing prevention campaigns to stop gay men from catching the virus, as well as looking after the very ill ones, many of whom were in the last months of their lives. People like myself who were relatively well didn't get as much attention, and it was through making this point to my counsellor that we came up with a plan that was to become a very helpful part of my life at the time. My counsellor was seeing several other HIV positive people who, like me, wanted to meet others in the same boat. The stigma around HIV was so intense in those days that revealing your status to anyone, close friends, family or workmates, took a lot of soul searching for many of us, and stories about people losing their jobs, being rejected by friends and family when they came out as POS, sent chills up your spine. So to be able to meet other positive peers, to share your stories and your stresses seemed like an important way to go. My counsellor introduced a small group of his positive clients to each other, and M, name withheld for privacy reasons, offered to be our organiser and to debrief if needed with the counsellor if there were any issues with the group, which of course there were. The idea of the group was that we would meet in each other's homes on a Thursday night for a few hours and agree to protect each other's privacy at all cost, to never reveal another's status or membership of the group. We decided to call ourselves Melbourne Positive Friends, but the name itself was only for our own reference. At that early stage, the idea of it being publicly known as a group was forbidden. Every week, I look forward to our Thursday night catch-ups. There are usually one or two new faces, and the old hands like M and his partner M and me soon learned how to listen carefully, suggest possible solutions to some of the conundrums which came up. Telling a long-term partner was a particularly difficult one for quite a lot of people, giving the risk of losing the love and affection you'd built up if the partner was negative, and starting the argument about who infected who if the partner was subsequently also positive. For people like myself who was single then, I was more worried about how I could have a sex life if it meant I had to come out as HIV positive to prospective partners. Well, the AIDS Council campaign on safe sex and condom use, and in fact, the Victorian AIDS Council was telling people not to get tested because there was no treatments, you're only going to stress yourself. So it was sort of someone like myself who'd already been through it and knew I was, it was like, well, sorry, too late. But I think the point of it all is, though, anybody, if you're wanting to have a really close, intimate relation with somebody and you can't tell them something as important as the fact that you're HIV positive, it will come to bite you later on when you have to tell them for whatever reason, you have to go to hospital or whatever. And so that was a stress that I didn't want to live with, and I wanted to be able to tell my partners. But again, you had to be brave to do that. Back to Melbourne Positive Friends. I can't underestimate how important that group of people were to my ability to live through the storm of HIV and AIDS that was swirling around me. Any stress or insecurity that came my way during the week could be unloaded on a receptive audience who wanted to get each other through the crisis as much as we could. We liked each other's company, planned weekends away at beach houses, went for dinners and had theme nights. This group gave me the confidence to tell many of my friends about my diagnosis and eventually my family, who were remarkably supportive. Love won out, I'm pleased to say. All in all, when we eventually disbanded in 1993, we had 33 members pass through our collective doors. There were also inevitably people getting ill with AIDS, including myself, and some most tragically dying. By the end of the group, there were only 4 of our number left. Some of you in the audience will have dealt with that amount of mortality in a short space in your life, but for those who haven't, can I say it's a real challenge to hang on to your sanity. Who will be next? Will it be me? The signs of illness were not always obvious in group members, and some could pass away in the period of a weekend, which used to gobsmack me. You know, they would have attended the Thursday meeting, looked fine, and then they weren't there on Monday. And of course people said, well, maybe they took their own life, but quite often it just happened quickly. They had a cancer that didn't realise they had. Imagine if you were part of a group of friends who met every Thursday at a pub near you. I'm just putting this into your bellywick. If you shared an enormous amount of time together over 7 years, told each other some of your deepest secrets, joys and fears. The group really lifted your spirits, but then one by one, people started to die. For some it was protracted, for others it was quick. 29 people died over those 7 years. It's a sort of crazy, you might expect in the Middle Ages when there was no effective health system. And our little group was just a microcosm of what was happening in the gay community of Melbourne. This was happening everywhere, in Sydney and other large cities in the world. I lived with 3 members of the group at different times and spent a lot of my time ferrying them and myself to appointments at Fairfield Hospital, or the Queen's Infectious Diseases Hospital as it was called, which quite a lot of people had a laugh at when they saw that was the actual name of the hospital. Oh. The grounds were beautiful, set up to help people live through difficult long-term illnesses such as polio in the past. There were peacocks strutting about and the loveliest of gardens stretching down to Yarra River at the rear of the block. AIDS Council volunteers had built up the garden with a carousel where you could sit and admire the peace and tranquility. My friends all thought we'd hit the jackpot with the hospital though. The staff, the doctors, nurses, even the orderlies were all trained not to be judgmental about our condition, to be supportive and understanding. Given that a number of hospitals in Melbourne then wouldn't even take an AIDS patient, shows you how fortunate we were to have Fairfield. I met my long-term specialist, Dr. Jenny Hoy, there in 1991, and my GP, Richard Moore, not long afterwards, and they are still with me today over 30 years later. Their longevity with me is one of the reasons I'm still here. as is the love and support I've got from so many long-term friends, ex-workmates, my AIDS Council care team, fellow activists, my family, and the joy of my life, Joko, who came in the last few... But how I lucked out to get intelligent family members who learnt the facts about HIV once I came out to them in the late 80s is something I will always cherish, as that didn't happen for so many of my friends whose family and friends didn't want to know them. It's probably bad luck to have picked up HIV in the early 80s when we didn't know it was around, but I've lucked out with the support I've received from so many since. And I think that's my 10 minutes. Thanks.
Viral Stories was made possible with the support of the City of Melbourne Connected Communities Grant. Viral Stories is hosted by Living Positive Victoria, who have been representing people with HIV in Victoria since 1988.
That was the fourth of 5 viral stories in this series. Remember to subscribe to stay up to date with our podcast. And for more information, please visit livingpositivevictoria.org.au.